Hi, I'm Jim Martin. At Health Republic Insurance in New Jersey, we believe that all citizens need to be informed about the unique healthcare issues that affect their lives. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of One-on-One with Steve Adubato has been provided by Activists in cooperation with the American Medicine Chest Challenge. Choose New Jersey. Our mission is attracting companies to the Garden State. NJIT, New Jersey Institute of Technology. Health Republic Insurance of New Jersey. The New Jersey Education Association, working for great public schools for every child. Berkeley College. And by the Healthcare Foundation of New Jersey, founded by the Jewish community. Promotional support provided by the Star Ledger, powering NJ.com, and by Commerce Magazine.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Welcome to One-on-One. It is my pleasure to introduce for the first time with us Mr. Tom Allen. He is the President and Chief Executive Officer of Summit Behavioral Health. How you doing?
Good, Steve. Thank you very much for having me. I'm excited to be here.
Well, it's good to have you. This is part of a series of programs we're doing, trying to look at a whole range of issues, really doing with prescription drug abuse, which is in fact an epidemic, correct?
It is. It is. I'd say it's been probably the last 10 years you've seen numbers spike. Treatment for drug and alcohol, opiate drug and alcohol addiction, or opiate prescription abuse has gone up 300% in the last 10 years.
And your organization is dedicated to?
We're dedicated to treating the individuals that are suffering from the disease of alcoholism or addiction. You know this personally, don't you? I do. I'm a person in recovery, have been for a number of years now. I was also at one point addicted to prescription pain medication.
What makes you care so much about the people who suffer from these addictions? To the point where you'd start an organization, build a business plan, go out and get the funding, and do all the things it takes to be the CEO of an organization like this. Why'd you do that?
I'm an activist at heart, I think, beyond anything else. And a
lawyer by training.
A lawyer by training, yes, yes. And figured there were enough attorneys out there and not enough people that cared about stuff like this. So it is an issue that has affected my family, has affected people that are near and dear to my heart, and it's affected me personally. And it sort of lit a fire that out of all that negativity, out of all that destruction, that something positive could happen and make some sort of change on a macro level.
What have you seen, Tom?
I was telling you a little bit. I got into this a few years ago. I moved back to New Jersey. I had started a program out in Arizona. I came back to New Jersey and I wasn't sure which direction I wanted to head in. And the idea of doing another startup was somewhat scary. But I got involved with a couple organizations, NCADD New Jersey.
Which stands for?
National Council on Alcoholism and Drug Dependency.
What about our partner, Angelo Valenti?
The Partnership for Drug-Free.
Right.
There's a lot of good groups out there, and Angelo and the work that his organization is doing is amazing from the prevention standpoint, and NCAD or NCADD was doing more from a policy standpoint.
What was missing?
Not enough quality options in the state. I believe.
What does that mean?
There's a big treatment gap in New Jersey, and when I say treatment gap, there's roughly 950,000 individuals. I'm coming at it from the treatment end. Angelo's organization is looking at it from the prevention side, and I guess I'm sort of in that next component, which is the treatment of it. We have roughly 970,000 individuals in the state of New Jersey that are suffering from addiction or alcoholism. 6 in 10, 1 in 9 New Jerseyans, that roughly equates to 6 in 10 New Jerseyans know someone, whether it's a friend, coworker, or family member, that's suffering from addiction. It affects everybody in one way or another.
Where do they go?
Well, that was my impetus for this. I had gone to one too many funerals. I believe it was 8 over a 18-month period for young adults ages 18 to 26. A lot of these kids that, when I say kids, I mean young adult. A lot of these young adults that we were working with were, if they were insured, they were going to the few options in New Jersey that had available beds or accessibility. More often than not, they were getting sent to places such as Florida or Arizona or Pennsylvania, which made it difficult for the family to participate in the treatment process. And I do believe this is an illness that affects the family.
Yeah, okay, so here's a couple things. A, why are we so far behind? And B, what's it feel like to be fighting this fight? First of all, how could we be this far behind when we know this problem exists, this epidemic?
Couple things. I'm going to address it from the treatment and development side. To get any residential treatment program open in New Jersey, it's a minor miracle.
So I live in a town of Montclair.
Yep.
And all of a sudden they say, you know what? We care about this problem, and we're going to house a residential treatment facility for people who are struggling with these addictions, right?
Yep.
Drug addiction?
Yep.
We're going to be in your neighborhood, Steve Adubato. What's going to happen?
Not in my backyard.
How do you know that?
I'm not saying specifically.
What happens in most people's backyards?
I've been involved with a number of zoning situations where we tried to open, and a lot of misinformation is out there about what drug and alcohol treatment is, what an addict looks like. An addict looks like me, looks like you, looks like the guy next door. But there's this misconception out there, or this stereotype that it's a raving lunatic under a bridge, and it's a normal person that when I say normal, it's an everyday looking person.
So when people say no, not in my backyard, what happens?
We've had the opportunity to go into several different communities to present residential options. And usually what happens is we present a plan to the zoning board, and land use laws are very rigid in New Jersey. Because we're such a densely populated state, these land use laws are very rigid. So it's very hard to get a variance to operate a facility. Sure. And as soon as you release notice that you're, or put notice out that you're going to open a facility,
they push back. The time is limited, so I want to be clear here. When you can't house it there, when you can't put it there, either what? It doesn't happen, or they go to another state. What happens?
They go to another state.
And so what happens to the people in New Jersey?
They're stuck finding an option in Florida, finding an option in Pennsylvania, finding a limited option in New Jersey, which is
Devil's
ideal.
advocate, what's wrong with that?
It's not including the family in the process.
Why do you need the family?
It's a family illness. In '56, alcohol was recognized as an illness. In '66, alcoholism was recognized as a disease. '74, addiction was recognized by a disease by the AMA. It's an illness, it's a disease, it's a family disease. If the family's not involved in the recovery process, the prognosis for recovery for the addict or their loved one is very slim.
So therefore, where the patient is being treated matters greatly, depending upon whether the family is going to be involved or not.
Absolutely, absolutely. Our continuum right now, we're building a number of programs throughout the state. We've got a number of outpatient centers already open. But it was very important for us to strategically place these locations throughout the state that were accessible by New Jerseyans without a long commute or a long distance, so that the family could be involved in the treatment process.
It's really complicated stuff, Tom. You got to fight this fight every day. And the one message I took away from this, other than the fact that people will often say, we're all for you, but not in my backyard, the other one is, this is, in fact, a family disease. And throughout this segment, you saw a website, or a couple of websites, right? The Summit Behavioral Health website, but also, could you do the other one, not only the other one for our partners at the Angela Valenti's organization, the partnership, right? Do we have that one as well, or no? Thank you very much. We'll put that up, and it's important that people reach out because you cannot fight this one alone. Tom Allen, who is the president and CEO of Summit Behavioral Health, I want to thank you for joining us. We appreciate it.
Thank you very much for having me.
You got it. Stay there. We'll be right back on One-on-One right after this.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org. Find us on Facebook at facebook.com/Steve Adubato, PhD, and follow us on Twitter at Steve Adubato.
There he is, Curtis Moore. He's an alumnus at Community Education Centers. Good to see you.
Nice to meet you.
You were here to tell your story,
Yes.
to motivate others. You mind if I tell a little bit about you?
Sure. No problem.
Okay. You are a writer. You're a motivator. You're a former gang member.
Well, former associate of a gang.
I apologize. Former associate. And you spent some time incarcerated.
Yes.
From the ages of?
18 to 32.
It's interesting. You came to us through our friend John Clancy at Community Education Centers. They're involved in alternatives, building alternatives to traditional incarceration situations. You spent all those years in prison. What were you doing when you were in prison?
Initially, when I first went in, just still had the same mentality, just, coming up in the streets of Newark, just going there and hanging with a lot of the friends that I knew from the streets.
Your friends in prison, were your friends from the outside?
Yes. So just hanging with them is basically like I was still living the same type of lifestyle until I actually got in trouble inside of prison and was sent to the hole, to solitary confinement, and they had me in a segregation unit in a single cell for I was in there for 3 years by myself. So
3 years.
3 years. So just being in that cell alone, you had nothing but time to think. When you didn't have a TV, a radio, nothing. All you had was just books.
What'd you start reading?
I actually started reading about just different religions, about Herbert W. Armstrong, different psychology books about W.E.B. Du Bois, Martin Luther King, Malcolm X, things of that nature. So
What'd you take from it?
that I was better than what I was settling for in life. That I basically was settling for a minute life. When God didn't create me to settle for that. So
you're reading, you're realizing that you're better than you thought you were. You were an associate of some gangs going in. So what happens? What decision do you make? And at what point was that where you said, not only am I better, but I have something to offer other people?
Well, just being raised in Newark on a mother, with a mother on welfare, if 7 of us.
Where was your dad?
My dad was around, but he wasn't around. He was there, but he wasn't there. He was always there for me to call on him, but he wasn't in the same household with us. And he lived in a different state. So just hanging with the different friends, like the associates, and most of them, I would have 15 years. Most of them had 75 years. Some of them
75-year sentence.
Some had 150 years. Some had
Obviously
45,
for first-degree murder.
for first degree and other things. So I just realized that wasn't. God gave me an opportunity to walk out of here. So I knew I had. I prayed when I first got sentenced. I said, God, if you allow me the opportunity to walk out of here, I promise you I won't walk out of the same person I walked in as. And
so when you walk out, you decide you're going to do what for other people? Because you made a huge transition.
I was going to reach back because I realized just being an advocate counselor now.
And describe that, an advocate counselor where?
I'm a youth advocate counselor at the Urban League of Essex County. Thanks to my director Banks for giving me the opportunity, and Mr. Thomas and Mr. Kareem and Ms. Frazier.
Have you had a few mentors?
I actually had a lot of mentors.
People looked out for you, cared for you?
People looked out for me.
Good, I'm sorry.
It's just, people wanting to reach back and not just knowing how our generation is hurting. Our generation is the crime rate is not high because people was born to be murderers. People was born wanting to join gangs, but they're outside. Tupac Shakur once said, and I quote that, we don't share tears, we share blood. And our generation, the younger people they're hurting, but they're not shedding tears to emphasize their hurt. They're out there shedding blood.
Do they even know there's another option?
A lot of them don't.
Do they think the only option is a gang?
Some of them do. Some of them do.
What do you say?
That there's other options.
When
that
you
even
say
though
that-
some people that are involved in the game, it's a lot of people that's out there that are involved in the game that's making a difference in the community. So it's like that when you're involved in the game, that doesn't mean that you cut off from life. Like there's still room to grow. If there's always a tomorrow, there's always hope. And I like to tell my clients at my job that if you're prepared today, then you'll own your tomorrow. So while I was incarcerated, I realized that what I wanted in life wasn't what I was settling for. So I began to prepare myself. I actually dropped out of school in the 6th grade. So I couldn't read or write. But I taught myself while incarcerated how to read and write. And I ended up graduating as a salutatorian. So I started, and I said, you know what? And I started talking to other young people about my aspirations and goals in life, and they was inspired. So I said, let me write a book.
You know, it's interesting because you got this book, because you some of this at Harbor House, which is one of the community education facilities. And that had a big part of this too, right?
Yeah.
But the book, you're going to publish this book?
I'm in the works now trying to get it published.
You're going to publish it?
Yes.
And it's so interesting to me. I wonder, I'm trying to imagine what it's like, Curtis, when you are talking to younger, I imagine they're younger. How old are you right now?
I'm 33.
Younger men than you, even teenagers as well.
Yeah.
And they hear your story of those years in prison, and that you made a decision, and that there are other options. Do you know when you have the spark of some possibility that you can turn one of these, not that you can turn a kid around, but you have a shot? Do you know? Do you have a sense?
When they start asking questions. When they start asking questions and asking, well, what if I wanted to do this? Or what if I do this? Then I feel that that's where the spark is at. Like, you know what, let me just feed on that.
What do you do then?
I really, like, my director, she would tell me that sometimes I come off as being emotional, but because I'm over passionate about it. Sometimes I work I go to work at 9, sometimes I get off at 9, sometimes I get off at 10.
Where's your passion come from?
Where my passion come from?
Where does it come from?
Being in that situation and not having nobody there like myself for me.
So what do you see your job as now?
Not just a role model, but as a voice for them, because a lot of people write our youth off, and they say that there's no hope for them, that they're in the gangs, they're in the street. But I'm a voice for them. Like I was one of them, and if I look at me now,
Look at you now.
so I became a voice for my younger generation.
What does it feel like for you? I mean, you were just telling me you had a big speech just the other day. You know, you said you used to use the word nerve-wracking, right? You don't seem nervous at all to be on public television right now.
I think that's the initial feeling when you do, because I'm a motivational speaker as well. So I think every time before I do my speeches, I always get them butterflies in my stomach.
What's it feel like right now? To know that you're reaching people right now.
I'm actually excited. I mean, I'm grateful for the opportunity, because when I was in prison, like I say, I ride hard on, if you prepare today, you'll own your tomorrow. Some people may call it crazy, but I used to stand in the mirror in my cell and actually, like I was doing interviews, like I was speaking to people.
That you were actually being interviewed, talking about
my
but
struggle.
you were out.
Yes, no pun intended. Seriously, all seriously, like I was my audience, and I used to get myself excited about it, and
now you're doing it.
Now I'm doing it.
You're going to keep doing it, aren't you?
Absolutely, absolutely.
When the book gets published, would you allow us to be one of the places on your book tour? Will you come and promote it?
Sure, why not? The name of the book is I'm a Survivor.
I'm a Survivor.
I'm a Survivor.
You are. And I have a feeling you're going to help a lot of other people have a chance to survive. We appreciate you being with us.
Appreciate being here.
And thank you.
Thank you.
Stay right there. Okay. This is one-on-one. We'll be right back right after this. Thank you.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org. Find us on Facebook at facebook.com/Steve Adubato, PhD, and follow us on Twitter at Steve Adubato.
Larry Downs is the Chief Executive Officer of the Medical Society of New Jersey. Good to see you, Larry.
Good to be here, Steve.
We often have you on our sister program, Capital Report, talking public policy, but we're going to shift gears a little bit on one-on-one. The Affordable Care Act, so many different pieces to it. You wanted to come in and talk about the Medicaid eligibility piece, but it's got a physician side. What are we talking about? It sounds complex to me.
Yeah, I think that it's a good thing that the state has expanded eligibility in Medicaid.
What does that mean?
It gets more people in different income brackets eligible for insurance.
Now, Medicaid, not Medicare. Medicare is for those who are elderly.
Over 65.
Medicaid is for those who financially qualify.
Yes, at lower levels of, at percentages of poverty.
Okay, so it's been expanded.
It's been expanded to include more people in income brackets that are higher than traditionally was
Okay, so
eligible.
where are the physicians for this?
It's a terrific concept. The problem here in New Jersey is that our program has been underfunded by various administrations for decades, and it's created a culture among physicians that they would rather provide care for free than to participate in the Medicaid program. It is probably one or two in the lowest paying Medicaid programs in the country.
Explain that. Patient comes in, now newly eligible based on the expanded Medicaid eligibility. Patient comes in. One of your doctors says, I want to treat you, but what?
It comes before that, Steve. When you try to find a physician, you'll have limited choices because very few numbers of physicians will accept Medicaid as a participating physician. So there's more in the primary care world, but primary care physicians sometimes have difficulty referring complicated patients out to specialists, and specialists routinely do not participate in the program because it simply pays too low of a fee to maintain a financially viable practice. And that is a significant issue that the state needs to address.
Okay, you say, quote, the state needs to address it. Translate that in terms of action.
Well, the ACA provided
The Affordable Care Act, otherwise known as Obamacare.
Federal legislation that expanded our insurance options, actually had a provision in it that allows Medicare rates to be paid to Medicaid doctors for the first 2 years of the program. Medicare pays substantially more than Medicaid in the state. Okay, so we've raised the Medicaid rates to Medicare for 2 years. That expires this year. So we have to make some decisions about how we're going to continue to fund that expanded rate so that we have enough physicians in the Medicaid program to handle the expanded number of people who have enrolled in it.
Who has to vote on this? How does it happen?
I think it happens through the budget process. It can happen through a number of different mechanisms, but the fact remains that we need to invest in this program if we're going to expand it, and it's going to be a viable healthcare solution.
If it doesn't happen, what happens? Translate that for those who, in fact, are Medicaid eligible, who need health care, and if they don't get it, they wind up back in the emergency room.
But here's the hard part, yes.
Which is the whole idea of how we started this. We didn't want them in the emergency room because it drives up cost, and so-called charity care cases the rest of us pay.
People will continue to get their health care when they need it. They just won't be at the right site for the care. They'll go to the emergency room, which is a high-cost environment, instead of getting in a doctor's office. So
and they're waiting too long to get it.
And Steve, we're hearing from people in federally qualified health centers, which provide primary care in inner cities, that referrals to specialty care can take months. And when I tell my doctors about that,
what does that mean? Translate that. You see a primary care physician, he or she says, you need to see a specialist.
So I come to the primary care doc with an eye problem. You need a referral to an ophthalmologist because I'm not qualified to handle your glaucoma or whatever the issue may be. The time to the appointment for the specialist can be months or weeks, at which time the condition exacerbates. Maybe you
What's happening to your eyes? Getting worse?
It's getting worse. The condition's exacerbating, and then you go get care at an emergency room because you haven't been able to meet your appointment. We need to have a better and more thoughtful discussion in the state about how we're going to care for the poor, and how we're going to create solid networks of both primary care doctors and specialists, so everyone has access to care going forward.
But here's the thing, Larry. You and I have had this conversation for years about healthcare, well over a decade. But since the advent of Obamacare, it often seems that so much of the discussion and the debate is about it's the worst thing in the world, or it's really very good, but the rollout's been tough. It's been a little complicated. The president didn't exactly say it the way it is when he said, if you like your care, if you like your doctor, you keep your doctor. But to get these two polar opposites, right, positions, mostly on cable television late at night. You know the channels I'm talking about. Here on public television, that's not the discussion. Here's my point. What is the average person supposed to do who wants to get their eye taken care of? Because those discussions don't help them.
Well, I think
you know what I'm talking about.
On the ACA rollout, I think whenever you have a huge system like the healthcare system in New Jersey or any state or the country, and you make massive changes to it, we can expect some problems.
Right.
Thankfully, the physician-patient relationship is not through a website. It's a human interaction, and things will get taken care of.
Do you believe the basic doctor-patient relationship will change dramatically on the negative side because of the implementation of Obamacare?
I hope not. It is the backbone of the U.S. healthcare system. I think that physicians and patients will always have a relationship. I just hope that the insurance models that are built around financing the care have to understand that patients and doctors get to know each other over a course of years, and the care gets better and cheaper and better when you have regular care with the same provider, or the same provider team. So I think it'll change a little bit in terms of we're developing more team-based care models.
What was that, a team-based model?
Well,
I want to see my doctor. Why do I have to see a team?
We talked a little bit about the physician shortage. You mentioned it in your opening comments. By most accounts, there will be some kind of a shortage. I think some of the assumptions that some of the shortages are projected on are faulty. I think they think about me and you, doctor-patient, this is the interaction, and we're not going to have doctors have this kind of interaction. I think they fail to take into account that physicians, nurses, medical assistants, other will work in a physician-led team in the future and be able to expand care. It's not that a physician has to do every single task, but a physician needs to lead the team so that a patient coming into a care team, if they need access to a physician, they get it. No matter what your station in life, no matter who your insurer is, you get access to a physician. That's the key part of the
Larry Downs is the CEO of the Medical Society of New Jersey. Next time you come back on Capital Report, you'll talk to us about how we're going to try to close the gap on the physician side, on the primary care physicians. Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Activists in cooperation with the American Medicine Chest Challenge, Choose New Jersey, NJIT, Health Republic Insurance of New Jersey, the New Jersey Education Association, Berkeley College, and by the Healthcare Foundation of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.
New Jersey invented the light bulb. It keeps us well-lit and monster-free. Today, New Jersey produces megawatt minds that power innovation. Choose New Jersey and enter a state of brilliance.